Hello class, Professor VanDeusen here. Welcome to the simulation lab. This PowerPoint is going to give us a little bit of information about our simulation labs. For some of you it'll be a review, for some of you it'll be the first time getting any information about our simulation lab, so welcome. There is a simulation tab on Moodle, which is probably where you found this video, and there will also be picture gallery link on there and a link to simulation articles that are evidence-based. Review the information that's found here to familiarize yourself with the lab before coming to your first lab day. It'll be very helpful to you. The picture that's on the upper left-hand side here, diagnostic tools. It's a picture of a chest x-ray. We use diagnostic tools with most of our simulations, whether it's a CAT scan result, x-rays, MRIs. We usually have some kind of diagnostic tools, EKGs. The picture on the upper right-hand side here has a picture of a suction gauge. These are things that are found on our walls, the oxygen meter. We have a bag valve mask, and something just to note about the bag valve masks. There is one behind every mannequin in the sim lab, and it is size appropriate for the mannequin that it is behind. So the adult ones are behind the adults, the pediatric ones behind pediatric Cal, and we do have an infant one in our neonatal cart. The picture that's on the bottom left corner is our simulated arms that are for IV sticks. So in 202, the students will learn how to do blood draws, and they learn how to do them on these arms. And finally, the picture in the bottom right-hand corner are students waiting to deliver our baby. We do have a mannequin that delivers, and it's a really fun process. Students enjoy that a lot, and we can do multiple types of deliveries with that simulator. So supply carts in the rooms. So these carts contain pediatric and adult supplies, and they are labeled as such. For example, the cart that's on the right, this one is in our main sim suite, which has our Susie simulator in it. That's the name of our mannequin that's in there, Susie. She's the one we use the most. She has the most functions. The top two drawers are labeled medications. Those have PO meds that are labeled and IV medications. There's a pretty good stock in there of simulated medications that can be used for multiple simulations. The third drawer down has AccuCheck machine and urinary supplies, so Foley's, straight cats. The next drawer down, so the two bigger drawers on the bottom here, so drawers 4 and 5. The fourth drawer has all the GI supplies and respiratory supplies. It's split in half. So on the left-hand side is the GI stuff. It's got suction, NG tubes, all the suction tubing. And then on the right-hand side of that drawer, all the respiratory supplies. So nasal cannulas, masks, intubation supplies, venti masks, inhalers, anything that you should need for respiratory is in that drawer. Very bottom drawer of that cart, IV fluids and IV fluid supplies. So that's going to have your 1 liter bags, your 500 ml bags, 200 ml bags, 100 ml bags, and it's going to have main continuous IV tubing, secondary tubing. There's labels in there for your piggybacks to label if you need a antibiotic and you need to label a 100 ml bag for a piggyback. Everything that you need for IV fluids should be in that bottom drawer. And then there's a small drawer to the right, that is the lab drawer. Tourniquets, butterflies, all the rainbows, colors of lab tubes are in there. Collection cups for sputum, stool, urine, COVID swabs, all found in that drawer. The drawer above it that the Kelly clamps are hanging off of, that drawer is full of sterile gloves. So when you go to do a straight cath or a procedure that you need sterile gloves for, that drawer is filled with sterile gloves of all different sizes. Now the drawer that's on the left, that's a pediatric supply cart. It's over by pediatric hal. That's in our bigger simulation area. The drawer on the top is the respiratory drawer that has all the respiratory supplies in it for pediatrics. Pediatric masks, they're very cute. They have little tigers and stuff on them. Pediatric nasal cannulas, pediatric intubation supplies. The next drawer down, the middle drawer, has IV tubing, IV bags, and then the very bottom drawer there has lab supplies. So everything you need, same as Susie's drawers for labs, but it also has pediatric catheter kits and pediatric straight caths. And that's all found down at the bottom. And I believe there might even be the pediatric NG tubes are in there as well. On top of that cart, you'll see that there's the 5-lead cardiac monitors as well. And every single room has a drug book. Every single cart has a drug book on top. Now, before each simulation, we do what's called a pre-briefing. And we like to use an app called Quizzes. You can either go to your app store on either any device that you have, whether it's an Apple or a Samsung or whatever, and type in Quizzes, Quizzizz. I think it's a purple app unless I changed it. You can download that, and on the day of the simulation, we'll give you a code. And this access code, all you have to do is type it in, and it'll ask you to enter your name. And that starts you on this quiz-based app. And you just go through and you follow the prompts. If you don't want to download the app, you can go on any device, whether it's a laptop, computer, tablets, whatever, and go to joinmyquiz.com, and you'll be able to do it from there as well. You enter the code, you put in your name, and you answer the questions. The idea of this pre-brief is that it gives you information about the patient. So it's less of a quiz and it's not graded. Some of the quiz questions are really just information about the patient, like your patient today is a 56-year-old female. They're here for a broken femur from a car crash. Press OK or type in OK to continue. So it's like an open-ended question, and you just type OK. That is the correct answer because I told you to type OK to continue, and you go to the next question, and it'll give you more information. And then there are some questions that are truly like you have to get the right answer to go to the next question. You know, this patient weighs 140 pounds. How many kilograms is that? And you have to choose the right answer. This will help you know your patient's weight, some of the medications that they're on, safe doses. It'll give you an opportunity to look up some of the medications that they're on before you go into the simulations, look up some diagnoses before you go into the simulations so you feel like you're prepared and have a good baseline before you go in and actually meet your patient. When you enter the simulation, even though this is a not real environment, you need to enter the room and introduce yourself to the patient and introduce yourself to any family members that are in the room. Sometimes students are assigned family member roles. Remember to ask questions and do detective work, even if you think you already know the diagnosis. You need to rule out differential diagnoses. So just because you had a class yesterday on anxiety doesn't mean that necessarily today's patient's having a panic attack. You want to rule out different diagnoses so that you don't put blinders on and miss something. Begin with a head-to-toe assessment. Focus on the cause of the current problem. The patients, so these mannequins, they have lung sounds, bowel sounds, heart sounds, they have peripheral pulses. They have vital signs on a real-time monitor, and they can answer your questions. So they do have a limited vocabulary on their own, and we can also speak through them. And sometimes there is a little bit of a delay for word searching, but you can carry on a conversation with these simulators. If you were wearing gloves in real life, you should be having them on in the simulation room. So if you are placing a Foley, wear sterile gloves. If you are doing something hands-on with the patient, and you should have the regular gloves on, put gloves on. We have boxes of gloves in the room for you and throughout the simulation lab in every single size. You can use all the tools in the drawer. We want you to not use the word pretend as much as possible. I want you to spike the bags, pop the pill packs. I have thousands and thousands of pills, so please open them up, put them in the pill cups, and don't put them in her mouth, but pretend to administer them to her, and we can throw them away after. Apply the nasal cannula, set up the suction, collect the lab tubes and the swabs in the collection containers as ordered. Perform as much as realistically possible without using the word pretend to accomplish your goals. So the word pretend has really got to go out the window. We have so much stuff stocked in these carts that I really, really want you to do as much hands-on as possible, and people learn better when they are hands-on. So the exceptions to that are no betadine swabs on the mannequin's skin, please. It does stain the silicone. So if you open a brand new Foley bag, a Foley pack, and there's a betadine swab package in there, we'll just throw it away. And usually I try to get to them first and throw them out. Please do not stick their skins with needles. IM and direct sticks can be verbalized at the point of injection. So if you get to that point, I want you to open the needle pack. I want you to get the syringe out. I want you to draw up the medication. I want you to choose a correct IM injection site or direct stick site, and I want you to verbalize that you're going to inject the patient. As far as the direct stick, I want you to apply the tourniquet. I want you to verbalize the collection of the labs, and I want you to have the lab tubes out. I don't expect everyone to know all the colors of the lab tubes because it's not something that we teach, but I am going to incorporate that, the lab tubes, into a lot of the pre-briefings so we can get familiarized with at least a couple of the very common ones, like the yellow and purple top tubes are used most frequently. I want you to take out specimen cups, verbalize the collections of the specimens, and label it. Use the provided Q-tips as nasal swabs for COVID tests and swab the nostrils. So it's 5 seconds on each side if there's a COVID test ordered. So things that you can do. You can pretend to do a bladder scan or an EKG. And once you verbalize that you've done those, I do have results for you. We will have EKGs that are completed and we'll give to you the results. You can pretend that your patient goes to CT or X-ray or any other diagnostic testing. You don't have to physically bring the patient out of the room or wheel the stretcher out of the room. You just say that patient went to CAT scan and we'll give you the CAT scan results. Say that patient went to X-ray and we'll give you the X-ray results. You can pretend to clean and hand wash if you verbalize it. When in doubt, verbalize it. If it doesn't get verbalized and verbalized loudly so we can hear it, then we don't know that it has gotten done. What else is possible? So our simulators can be catheterized for Foley placement, and they're able to be infused with IV fluids and IV push medications in their peripheral saline wells. The catheterization with the Foley catheters, the balloons can be inflated. They go into a small, soft bladder that's inside of our simulators, and they can be attached with a cath secure to the inside of the patient's leg. Urine will not come out. I have not set them up so that urine will flow. Some of our simulators have pupillary response for accurate neurological assessments, and that is pretty interesting to see. Some of our patients can display cyanotic skin coloration in response to respiratory distress. With instructor-led demonstration, we can visualize epiglottis and vocal cords with intubation tools, which in the picture here to the right, one of our nursing students is using a Miller blade to visualize the epiglottis. High quality CPR can be demonstrated and assessed in real time by the simulator's internal computer. So 3 of our simulators can provide real-time feedback for CPR. So while you're giving CPR, it can give us the depth, the rate, and the recoil of the quality of the CPR that you're giving. And you can adjust how you're giving your CPR based on the real-time feedback. Open Lab would be a great opportunity to come in and practice your CPR skills. And if that's something you'd be interested in, it would be something you could email myself, Professor VanDeusen, or Professor Kiernan could help you with that. Lastly, what if I make a mistake? So there are so many possibilities to discover new things in our simulation lab. Please keep in mind that although we're acting out realistic events and maintaining our professional roles, that this is a safe learning environment and that the patients are not real. Therefore, these patients cannot actually be harmed and they cannot die. Mistakes are going to happen and that is expected. The most important thing is that they are a teaching moment and learned from. And we debrief after every single case. So if you feel like something really went wrong or you feel really bad about something, we do talk about it after every single case. The most important thing is any mistakes that are made is that we learn from them so they don't happen again. And this is a safe learning environment. One of the best things about simulation is the advantage of repetition. So the more we can do something over and over again, we'll build our confidence and our skills so that when we get out into the real world, doing that skill on a patient is not you doing it for the first time. You have mastered that skill through repetition and building your self-confidence by practicing it hands-on over and over and over again. Sometimes, even if it's on a simulator, going through the motions, working that skill hands-on, physically doing it with your hands, like physically with your hands doing it, that muscle memory retention will be so beneficial to you in the long run. So please don't hesitate to reach out for any open SimLab time. Thank you so much for listening to this presentation for the SimLab, and I hope to see you soon.